everyone, I'm Dr. Cheryl Lim, and today we're going to talk about something that many men over 50 are curious about but may feel paiseh to discuss openly. Over my 20 years of medical practice here in Singapore, I've seen countless men at my clinic sitting in that chair, wanting to ask questions but not quite sure how to start the conversation. So let me just say it straightforwardly. Can regular ejaculation actually help protect your prostate health? The answer might surprise you. Before we dive deep, let me share something important. A major study found that men who ejaculate 21 or more times per month have a 33% lower risk of developing serious prostate problems compared to those who ejaculate only 4 to 7 times monthly. That's a significant difference, right? So whether you're single, married, or in between, this information applies to all of you. Now, I know what some of you are thinking, Dr. Lim, I'm already 60 plus, sometimes cannot get it up anymore. How to achieve this? Don't worry, we'll address that later in this video. But first, let's understand why this matters so much for your health. Let me explain what's happening with your prostate as you age. The prostate is a walnut-sized gland located just below your bladder. Think of it like a small donut surrounding part of your urethra. As we get older, this gland tends to enlarge, a condition we call benign prostatic hyperplasia, or BPH for short. Very common, especially for men above 50. When the prostate gets bigger, it can squeeze your urethra like someone stepping on a garden hose, making it difficult to pass urine properly. You know the symptoms, right? Having to wake up 3-4 times at night to pee, standing at the toilet bowl for a long time waiting for the stream to start, feeling like you never fully empty your bladder. Some of my patients joke that they spend more time in the toilet than at the kopitiam these days, but honestly, it's no joke when it affects your sleep, your daily activities, and your quality of life. So here's where the research gets interesting. Studies from major universities, including Harvard Medical School, have been looking at this connection between ejaculation frequency and prostate health for decades now. What they found is quite remarkable. Regular ejaculation appears to help flush out substances that accumulate in the prostate gland. Think of it like cleaning out your drains regularly so they don't get blocked up with gunk. When you ejaculate, the prostate contracts and releases fluids. This process helps clear out potentially harmful substances, including inflammatory chemicals and cellular debris that might otherwise build up and cause problems. It's like doing regular maintenance on your HDB flat, you know. You don't wait until everything breaks down before you take action. The research also showed that men who maintain regular ejaculation patterns around 2 to 3 times per week tend to have fewer urinary symptoms related to prostate enlargement. The mechanism is straightforward. Ejaculation reduces pressure in the prostate area and helps maintain healthy blood circulation to the tissues. Good blood flow means better oxygen supply, which keeps everything functioning properly. But let me be very clear about something. I'm not saying that masturbation is some kind of miracle cure or that it can replace proper medical care. It's one piece of the puzzle, okay? You still need to eat right, exercise regularly, maintain a healthy weight, and get your regular health screenings. Which brings me to an important point that many of my patients have mentioned. You see, there are actually 5 major risk factors that can seriously impact your prostate health and overall well-being. Think of them like 5 horsemen bringing trouble to your doorstep. First, being overweight or obese. Excess body fat, especially around your belly, increases inflammation throughout your body, including your prostate. Second, lack of physical activity. When you sit around too much, blood circulation suffers and that affects every organ, including your prostate. Third is poor diet. Too much processed food, red meat, and sugar can increase your cancer risk. Here in Singapore, we love our chicken rice, char kway teow, and mee goreng, but moderation is key lah. Fourth, excessive alcohol consumption. I'm not saying you cannot enjoy your tiger beer or whiskey, but everything in moderation. Finally, smoking cigarettes. This one is really bad news for your prostate and practically every other organ in your body. So while we're talking about the benefits of regular sexual activity, please don't ignore these 5 factors. They work together. You understand? You cannot just rely on one aspect and neglect everything else. Now let's talk about the psychological benefits because this is equally important. Many older men tell me they feel lonely, especially if they are single or widowed. Some feel like their masculine identity is fading as they age. Regular sexual activity, whether with a partner or alone, helps maintain that connection with your body and your sense of self. It's not just physical, it's emotional and mental too. When you ejaculate, your body releases endorphins, the feel-good chemicals that reduce stress and improve your mood. In my practice, I've noticed that patients who maintain a healthy, intimate life tend to be more positive, less anxious, and generally happier. they also tend to take better care of themselves in other areas like diet and exercise. It's all connected. Masturbation also helps maintain the health and sensitivity of your genital tissues. Regular blood flow keeps the nerves functioning properly and the tissues elastic. For men who are not currently in sexual relationships, this self-care practice helps prevent what we call use it or lose it syndrome. The body is amazing, but it needs regular stimulation to maintain optimal function. But here's something very important I need to address, because I know many of you watching this are facing this challenge. What if you're 60, 65, 70 years old and you're having difficulty achieving or maintaining an erection? Does that mean you cannot benefit from these findings? Not at all. First, understand that erectile difficulties are extremely common as we age. It doesn't mean you're not masculine or that something is fundamentally wrong with you. Many factors contribute to this: reduced testosterone levels, medications for blood pressure or cholesterol, diabetes, stress, or simply the natural aging process. Right? If you're having trouble with erections, please go see your doctor. There are many treatment options available today, from medications like Viagra and Cialis to other therapies that can help. Like, don't suffer in silence or feel embarrassed. We doctors have seen everything, trust me. Nothing you tell us will shock us. But even if you cannot achieve full erection, you can still experience sexual pleasure and sometimes ejaculation through other means. Prostate massage, for example, can stimulate ejaculation without requiring an erection. Some men find that with patience and the right stimulation, they can still achieve climax even with a less firm erection. The key is not to give up and think it's all over. Now let me give you some important warnings, because this is where people sometimes get into trouble. If you have acute prostatitis, which is a painful infection of the prostate, masturbation during the acute phase might cause more pain and discomfort. Wait until the infection clears up first. Similarly, if you've been diagnosed with advanced prostate cancer or you're undergoing certain treatments, you need to consult your oncologist about what's safe for you. For most men with benign conditions or early stage issues, regular ejaculation is generally safe and beneficial. But everyone's situation is unique. That's why I always tell my patients, don't self-diagnose or self-treat. Come in for proper evaluation. We'll do the necessary tests, including digital rectal examination and PSA blood tests to check your prostate health. The recommended frequency based on research is around 2 to 3 times per week. But honestly, you don't need to be so rigid about it. Some weeks might be more, some weeks less. What matters is maintaining some regularity without becoming obsessive or anxious about it. It should be natural and comfortable for you. Let me also address the practical lifestyle factors that support prostate health. Your diet plays a huge role. Try to eat more vegetables, especially the cruciferous ones like broccoli and kale. Tomatoes are excellent because they contain lycopene, which studies show may protect against prostate cancer. Like fatty fish, like salmon, provides omega-3 fatty acids that reduce inflammation. Here in Singapore, we're blessed with fantastic hawker food, but we need to be smart about our choices. Instead of always going for the fried carrot cake or bak chor mee, maybe alternate with healthier options. Choose brown rice over white rice when you can. Cut down on the sugary drinks and coffee with too much condensed milk. I know it's shock, but your prostate will thank you for it. Exercise is absolutely crucial. You don't need to become a gym rat or run marathons. Even brisk walking for 30 minutes daily makes a significant difference. Swimming is excellent, especially for older joints. Tai Chi is popular among seniors here and provides great benefits for balance, flexibility, and overall health. Whatever activity you choose, consistency is more important than intensity. Weight management cannot be ignored. If you're carrying extra weight around your middle, work on gradually reducing it. Obesity significantly increases your risk of aggressive prostate cancer. I've seen too many patients whose health problems could have been avoided if they had maintained a healthier weight in their middle years. And please, if you smoke, quit. If you drink heavily, cut back. These lifestyle factors have enormous impact on your cancer risk and overall health. No amount of ejaculation frequency can compensate for smoking a pack a day or drinking excessively. You need to take a comprehensive approach to your health. Regular screening is also essential. Once you hit 50, you should be getting your prostate checked annually. If you have family history of prostate cancer, start even earlier. Maybe at 45, the PSA blood test and digital rectal exam might seem uncomfortable or paiseh, but they can catch problems early when they are most treatable. I've had patients tell me, Dr. Lim, I'm scared to check because what if they find something? But isn't it better to know and treat early rather than wait until symptoms become severe? Early detection saves lives. It's that simple. Let me share something from my years of practice. The patients who do best are those who take a proactive approach to their health. They don't wait until there's a crisis. They maintain healthy habits, get regular checkups, and address small problems before they become big ones. They also don't suffer in silence when something is bothering them. Your intimate health is part of your overall health. It's not separate or less important than your heart health or diabetes control. Everything is connected. When you take care of your sexual health, you're also taking care of your mental health, your relationship health, and your physical health. It's all intertwined. While for those of you who are married or in relationships, communication with your partner is vital. Many couples stop being intimate as they age, not because they don't want to, but because they don't talk about the changes they're experiencing. Maybe the husband is having erectile difficulties and feels embarrassed. Maybe the wife has vaginal dryness and finds sex uncomfortable. These are all normal age-related changes that can be addressed. Talk to each other, be patient and understanding, explore different ways of being intimate that don't necessarily involve penetrative sex. There are many ways to give and receive pleasure and maintain that connection with your partner. Don't let pride or embarrassment rob you of this important aspect of life. For single men or those who've lost their partners, self-care is equally important. Don't feel guilty or ashamed about masturbation. It's a normal, healthy practice that serves multiple purposes: physical health, stress relief, and maintaining function. Society sometimes makes older people feel like they should have no sexual desires or needs, but that's nonsense. Your needs don't disappear just because you've reached a certain age. As we get older, our bodies change, that's inevitable, but we also gain wisdom, patience, and often a better understanding of what truly matters in life. Embracing these changes while taking care of our health allows us to enjoy our later years with dignity and quality of life. You've worked hard all your life, raised families, contributed to society. You deserve to take care of yourself and enjoy good health. Remember, it's never too late to start making positive changes, even if you're 70 or 80. Improving your diet, starting gentle exercise, and maintaining regular health checkups will benefit you. Your body is remarkably resilient and responsive to good care at any age. I want to emphasize one more time, please don't view masturbation or sexual activity as a cure-all. It's one component of prostate health within a larger framework of healthy living. The research shows it has benefits, yes, but you must also address diet, exercise, weight, smoking, alcohol, and regular medical screening. All these pieces work together. If you take away one message from this video, let it be this: don't be paiseh to take care of your intimate health, and don't be scared to talk to your doctor about these issues. We're here to help you, not judge you. Your health and well-being are what matter most. Thank you for watching today. If you found this information helpful, please share it with other men who might benefit. Sometimes the most valuable gift we can give someone is knowledge that improves their health. Take care of yourselves, and I'll see you in the next video where we'll discuss more ways to maintain your health and vitality as you age. Stay healthy, everyone.